All right, if you're prepping for your boards, you know that Tan or phlegm fluid retention, is a topic you absolutely cannot afford to get wrong. So in the next few minutes, we're going to make sure you don't. We'll nail the key differentiations and the must-know formulas that are pretty much guaranteed to show up on your exam. Okay, so here's our game plan. We'll start with the basics of what Tan is, but then we're going to jump right into the tricky part, telling the 4 key types apart. Honestly, that's where most people win or lose points. From there, we'll lock in the treatment principles and the high-yield formulas you've got to have in your back pocket for exam day. First up, let's get this core concept down cold. You have to understand what Tan is at its heart, because every single question you face on this is going to build on this one idea. So here it is, the single most important thing to remember. Tangy isn't just about having too much fluid, it's about having stuck fluid. See, the problem isn't the water itself, it's that the body's water-moving machinery, the lungs, spleen, and kidney, has broken down. If you get that core mechanism, you're already way ahead of the curve. The name Tan is practically a built-in cheat sheet. For your boards, just burn this into your brain. Tan is the phlegm part. Think thick, sticky, turbid, often from heat. Yin, on the other hand, is the fluid part. Think thin, clear, watery, and from cold. It's a simple distinction, but it's the first critical sorting hat for any diagnostic question. Okay, let's get into the 4 patterns. This is prime material for board questions, because the diagnosis really comes down to one thing: location, location, location. The whole question is, where did the fluid get stuck? This table right here, this is your mental map. Seriously, commit this to memory. Tan is in the gut. Xuan is in the chest and ribs. Ji is in the chest and lungs. And Yi is everywhere, all over the body. Knowing the location is your first step to picking the right diagnosis and, more importantly, the right formula. And check this out. This is a perfect illustration of Xuan. You see the diagram of fluid building up in that pleural space, and the X-ray confirms it. This is exactly how a TCM concept, fluid stuck in the chest and hypochondrium, maps directly onto a Western diagnosis like pleural effusion. It's a great visual to lock in the idea. All right, now we get to the fun part. This is where exam writers love to try and trip you up, telling these patterns apart from other syndromes that can look really, really similar. Let's break down the 2 most common ones you'll see. So this is a classic board question trap: Xuan versus Chesby syndrome. The location and the type of pain are clues, for sure. But here's the exam-winning detail. Chesby is a qi problem, so aromatic herbs that move qi will make it better. Xuan is a fluid problem. Those herbs won't touch it. In a case study, that's your number 1 clue. And here's the other big comparison: Yi versus wind water. When you see a question like this on your exam, just run through a quick 3-point checklist. Number 1, onset. Was it slow or all of a sudden? Number 2, sweating. Is there any? And number 3, this is the big one: where did the edema start? If the answer is the eyelids, that's your classic sign for wind water. You check those 3 boxes, you'll get it right every time. So you've looked at the symptoms, you've nailed the location, and you've differentiated it from all those tricky lookalikes. Now what? Well, the next logical step and the next section of your exam is going to be all about the treatment plan. But hey, before we start cramming a bunch of specific formulas, let's talk about the big picture, the guiding strategy for all Tan patterns. If you understand the strategy, remembering the formulas becomes way, way easier. The core strategy is really simple and elegant. Warm and resolve. That's it. You have to warm the body's yang to give it the power to move and transform these cold, stuck fluids. And when you're thinking about acupuncture points, you're targeting the source of fluid metabolism, points that regulate the lungs, spleen, and stomach to get that whole system fired up and working again. All right, let's put that strategy into action. It's time for the main event: the high-yield formulas you're most likely to see on your boards. We're going to focus on 2 absolute classics that you just have to know. First up, Ling Gui Ju Gun Tong. If you see a case of Tan with clear signs of spleen-yang deficiency, things like dizziness, palpitations, maybe even a splashing sound in the stomach, this is your go-to. Its whole job is to warm up that spleen and get the water metabolism engine running again. Now, let's just take a second to appreciate how this formula works, because it's brilliant. You've got Fuling and Baiju doing the groundwork, strengthening the spleen and draining the dampness. But the real star of the show here is Guiji, the cinnamon twig. That's what warms the yang and provides the fire to actually transform the fluid. Gan Cao just comes in to harmonize the whole thing. It's just a beautiful, efficient formula. Now let's switch gears to a different pattern. This is Zian Yin, where you have cold fluids clogging up the lung, often after catching a cold.
For this, the key formula is Xiaoqing Long Tong. This one is famous because it does two things at once. It kicks out the exterior pathogen and it warms the lung to break up all that deep, cold fluid that's causing the cough and all that white sputum. And finally, just remember that your boards are going to test you on the whole treatment plan, and that always includes lifestyle advice. For any Tanyin condition, preventing it from coming back is everything. That means dealing with the root causes, diet, avoiding cold, and using gentle exercise to keep qi and fluids moving. If you master this, you won't just pass your exam. You'll be a practitioner who really, truly helps people heal. So think about it. What's that one piece of advice you'll give your future patients to empower them?